I never thought it was possible, and in a certain sense, I'm kind of impressed. But British Columbia Premier David Eby may be a worse liar than Prime Minister Justin Trudeau. Justin Trudeau tells really stupid lies, like we're the best economy in the G7 based on really skewed metrics where our GDP is technically going up faster than other countries, even though our GDP per capita is falling towards the earth because we're just growing our GDP based on population growth, not based on actual productivity. But David Eby will say something that is so profoundly wrong and just so obviously a lie that it makes you wonder if he's just trying to gaslight you and just failing miserably. He did a press conference the other day where he claimed that they are now hiring nurses and doctors at a faster rate than ever before. Like, if you're in BC, you already know why this is the dumbest possible thing for him to say. Like, he shouldn't even be wading into the general ballpark of the issue of healthcare. Everyone knows he sucks on that topic on multiple fronts, mostly because he has fired nurses and doctors for not being vaccinated for COVID-19, a virus that does not even matter anymore, still won't let them come back to work. But he actually posted this to his own X account. This wasn't just in a press conference where if you dug through the 2 hours it went on, you can find him saying something stupid. No, he thought this was good content. He thought he looked good in this clip. This was going to be a big vote getter in BC. Really all the NDP should be doing is just promising spending. Just promise money all over the place. Like, they have nothing left. Their party is losing momentum hard. The Conservatives in BC are gaining momentum fast, despite not even existing more than a year and a half ago. And now, and he somehow thinks that he's going to talk about healthcare. One of the big negatives for his government, I think like 78% of people, last time I checked in the polling that they did on issues, 78% of people think the current government sucks on the issue of healthcare. And you're going to talk about it more? If anything, I admire the spine on this guy for standing up there knowing that he looks like a complete clown. But before I get into this clip and this post he put up, make sure if you do live in BC that you've donated to the BC Conservatives. It's very difficult to actually gain a lot of funding to fight the NDP in this election. The maximum someone can donate is only $1,400, which is even less than the federal amount. You get 50% of your money back if you donate up to $550. You get 75% of your money back up to $100. So make sure you do donate. I have a link in the description below for Bruce Banman's campaign. I'm helping him out in Abbotsford South right now. If we win this riding, we can win the rest of them in the Fraser Valley, and we can actually get a majority government. So make sure if you live in BC, do that. But now let's get into what David Eby has posted here. He says, we're hiring more doctors and nurses than ever in BC. The Comox Valley is proof. Soon, 9 out of 10 people in the region will be attached to a doctor or nurse practitioner. Our goal is to make sure everyone in BC has access to healthcare when they need it. And before I get into the video here, maybe I'll do this right away. I want to pull up. Yeah, here we go right here. He's found one area of the province where his record doesn't look like complete garbage. And obviously, every province, even though generally Canadian healthcare across the board has been going down in quality year after year because the public system is destroying incentives for people to become doctors. But yes, 9 out of 10 people in the Comox Valley might have a doctor, but in general, the record has been terrible in British Columbia. Look at this. These are people who have a healthcare professional that they're attached to. In between 2015-16, 83.4% of British Columbians had a doctor. By 1920, it's 81.7%. And I know since this statistic was taken, it's fallen to about 78%. It's gotten even worse. The idea that we're going to find this small region of the province for say, 90% of people have a general practitioner. That's pathetic that you would even think that this was a good thing to bring up when your entire record overall has been horrible. Like surgeries in the last, in that people are able to get a surgery within 48 hours, a hip fracture surgery. In 2018-19, you could get 86.3% of people would get that surgery within 48 hours. Now it's only 72.3% in the 22-23 fiscal year. Again, nuts that this guy even thinks he can bring up healthcare, thinks he can bring it up with any level of credibility. And I hope that he keeps bringing it up because he keeps hurting himself by doing this. He doesn't understand that people don't see him as an authority. He was acclaimed by his party to become the premier. His own party, for some reason, the radicals in his party like him because he is a radical. But even they knew this guy can't even probably beat another NDP MLA or some random guy to become the premier. So we got to basically bully everyone into not fighting him because he comes off like an out-of-touch activist, because he literally is an out-of-touch protester activist who became the premier. In his own riding, I'm going to do an interview at some point with a conservative candidate from Point Grey. He could lose his riding in Vancouver Point Grey. That's how weak of a candidate he is. That riding is like a coin toss between him and his opponent, even though other MLAs, in the Vancouver area, other NDP MLAs are actually safe. He's not, because people don't like him. Here we go. Here's the video he posted along with this claim that we're doing super well in healthcare these days. Well, tons of nurses and doctors everywhere.
You can see here our vision for healthcare, the network of all the different services working together, supporting each other, nurse practitioners, physicians, nurses, allied health professionals, various kinds, pulling together. And that partnership between people here in the Valley, healthcare professionals here in the Valley, the provincial government with our new agreement with the Doctors of BC to recognize family physicians, to support the training and availability of nurse practice.
This guy cannot get through a small statement without like bombarding, machine gunning, just like a drive-by shooting of ums and ahs. You're just here to like try and pump up your record, and he knows he's lying. That's why he can't get through this without stumbling all over himself.
Has resulted in this remarkable situation where we are within striking distance of ensuring that everybody in the Comox Valley that wants to be can be attached to that long-term family.
And let's be very clear here. What David Eby is effectively admitting to is even in the best county, even in the best district of British Columbia, he doesn't even have 100% of people attached to a GP. Even in his best area, they are approaching 90%. That's sad. That's horrible. In certain areas of the province, there's less than 50% of people who have a general practitioner. People are leaving to the US. He fired 2,300 plus, I think it was actually 2,800, nurses and doctors for not being vaccinated. The wait times in BC are now becoming worse than Alberta. I'm from Alberta. It's actually pretty bad in Alberta because even though we spend the most per capita, we just do not make it easy to be a nurse or doctor just based on all of just the bureaucracy, paperwork, and whatnot. It's just annoying. So people go to the US. So many of the people, even if the BC Conservatives get back in, it might be hard to actually convince them to come back and work for BC Health again because they might be able to go down to the US or go to a different province where they may get treated better. I hope they come back, but this is the position the NDP's put the next government in, and I believe it will be the Conservatives. Hopefully, make sure to donate. Again, description below. That's the only advantage the NDP has over the BC Conservatives at this point is money. Nobody likes them on the issues. David Eby is a charisma vacuum, and now the only thing that they have is the fact that they have a lot of union allies and money from those areas. They've basically been trying to crack down on the way that you can fund your campaigns in order to try and prevent any challengers to them. So while they already had a lot of money from having a lot of infrastructure being the incumbent government, and they have a lot of union and other front group, activist allies who can spend money on their behalf, but not directly, they've made it almost impossible to fundraise. But here's another thing I actually want to quickly bring up. So I'm trying to find this post. I posted a little bit earlier. So the NDP is actually running effectively a fascist candidate in I think Surrey Newton. So in Surrey Newton, this lady Jessie Sooner, who was just announced as the candidate yesterday, actually calls her in her bio. It says human rights activist, labor lawyer for some hospital union, trade unionist, community activist, BC NDP nomination candidate for Surrey Newton. Trade unionism, I'm not sure if guys know what trade unionism means. It doesn't mean that you support unions. That's not what that means. If that was all it means, it would be like a worthless term. You could just say I like unions. Trade unionism, translated into Italian, means fascism, because In France, it was called syndicalism because they called their unions syndicates. In Italy, they called their unions fascio, and so they called it fascism. This lady is actually in favor of the idea that governments and unions should control society and the economy, that everything should be unionized. Everything, by that logic, should then be nationalized. Eby is surrounding himself with more activists. It's not going to get any better. There's a reason why, after Bonnie Henry, well, he went along with her firing all the nurses and doctors. It wasn't that was Bonnie Henry's call and he's going to respect it. No, he agreed with her. And that's why when she proposed selling meth, heroin, all other illicit drugs in any grocery store, convenience store, he said, oh, well, we disagree with her. The health minister came out and said, well, we won't take Bonnie Henry's advice on this one, even though they knew this report was coming for months, and they could have told her, no, you're going to scrap that and also get out of here. They didn't do any of that. They still have her employed because David Eby will do that someday. I guarantee if he wins the election, pilot program will be launched in some city to start selling safe supply drugs in their retail locations. They'll do it. And the thing is, it actually makes sense to do it. Not in the sense it's a good idea. Safe supply is horrible. Part of my master's degree when I did it on public policy was studying crime in cities like Toronto and Vancouver. And one of the big spikes in crime that occurred was when safe injection sites were opened and safe supply was started. That is when you see a big spike in crime as well as drug deaths. It's not a good program. But from the logic of somebody who believes in safe supply and safe injection sites and all this decriminalization garbage, why doesn't it make sense to sell drugs everywhere? So by David Eby saying, no, I'm not going to do the safe supply everywhere thing, he's effectively lying, because if he believes that the way that we save lives and the way that we make our communities better in terms of drug deaths is we just put even more drugs out there, but safe drugs, why wouldn't you sell them at retail locations? Because right now, if it's such a great program, why not expand it? It's not a good program. He thinks it's a good program. He just thinks we're too close to an election to announce it, because at least at the same time, he's dumb enough to think safe supply is good. He's not dumb enough to think that he can market this during a provincial election that they're falling down the drain. And like, again, look at these numbers right here. These are the only two polls I'll show you. But these are decided voters in British Columbia. The BC Conservatives and NDP are tied at 37%. When you throw in some undecided voters there's a lot of wiggle room, and there's a lot of people, not just, I guarantee a lot of people will go from NDP to Conservative as the candidates hit the doors. But the NDP only has 44% of BC residents considering them, with only 2% more people who don't know yet. That's a horrible number. The Conservatives have 51% of people considering them and still 8% more to win over. They definitely have the momentum. But I'll leave this video off here. But again, if you live in British Columbia, I have the donation link to Bruce Banman in Abbotsford South down here. We're trying to collect enough money so that we can 100% win this riding, and then we will start distributing funds to other areas in the Fraser Valley to win this area. It's a keystone region. If we can win the majority of ridings in the Fraser Valley, we can dig into the donut around the Vancouver area, win a couple of seats up in Vancouver Island, northern Vancouver Island. This is a very winnable election, and we are probably on track to win a 5-6 seat majority, but we just need the funds. Again, you get 75% of your money back if you donate $100. If you donate up to $550, you get 50% of your money back. The only advantage the NDP has at this point is money either through donors or through union front groups. So make sure you donate so that the Conservatives actually have the money to fight out this election. I know a lot of ridings where they're only working with a couple $1,000s at this point. So if we can pump that up, it becomes very competitive. Anyways, that should be it for me today, guys. If you don't live in BC, you can donate to my own legal fund in the description below. It's the Give, Send, Go link, or sign up at my website, WyattClaypool.com. If you want updates on local races in your area, it allows me, if you have a question about a nomination going on in your riding for the federal Conservatives, for a provincial party, I can look at the candidates, and then everyone else in that postal code that you live near, I can send all of you information on who's good, who's bad, things to watch out for. So it allows us to have kind of, being able to project a little bit more organized power in some of these ridings and some of these nominations where even just a few votes do make a difference. Anyways, that's it for me today. Have a good one.